Good morning, everybody, and welcome to the NSPA's third webinar. Really delighted to have so many of you joining us today. Just to be clear, this is a webinar and not one of our online conversations. So you'll be hearing from myself and a number of my lovely colleagues who will be talking about their own experiences. So let me just introduce the whole session and say the reason that we decided to start webinars as well as our online conversations was because when we ran some sessions on certain subjects, so reaching and supporting men, reaching and supporting children and young people, reaching those who self-harm, there was just huge demand, so much more than we could really hold a conversation with. There were 70, 80 people wanting to learn more about reaching and supporting children and young people during COVID. And so we thought we would put on a webinar with some really fantastic speakers, and so that we could share a lot of the learning and understanding that's been going on during COVID and since then. So just to kind of talk about what some of the issues were that we kind of were inspired to be thinking about when we were setting up the webinar. When we held the online conversation, there are a number of different things that people talked about. So there were some concerns that with schools and lots of other things shutting down, there were reductions in referrals. And alongside that, increases in anxiety and loneliness because children and young people then weren't as connected to their existing support networks. Some people were concerned that home might not feel safe for some young people. There were concerns that there were increases in negative coping strategies. And there was also awareness that for some young people, home felt safer than school or where they had been. So there was kind of a mixture of things. So that's kind of where this idea came from. We're going to get started in a minute, but we've got a little poll, which we thought would be really useful to just find out where people are coming from, who we've got on the webinar. So thanks, Emma. Emma's launched that there. I'm just going to let you guys fill that in for a minute. Great, sorry, it's on my other screen. That's why I'm looking over there. That's really interesting. So lots of people, Emma, if you want to end that, so people can have a see at who's there. We've got quite a large proportion of people from charities, people from local government and public health, and from the NHS. Great to have some academics, possibly students in there as well. So that's really fab. Sorry if some of you can't see that poll. It was just for our interest, really. Did I introduce myself? I'm Penny Foston. I'm the executive lead of the National Suicide Prevention Alliance, and I'm really delighted today that we'll be hearing from a number of real experts in this field. Sarah Skelton, who's head of program development at Papyrus, Laura Brown, regional development manager for Kooth, and Susie Phillips, associate director at Winston's Wish. And they've all got really different perspectives, as well as services that are reaching and supporting children and young people. After this session, we will be sharing the whole webinar. We'll be putting subtitles on and putting it up on our website, and we will email you all once we've done that. So if you lose connection for some reason or anything like that, that's fine. We will be putting it on the website and we'll email you all so you'll catch it. Also, suicide prevention can be a difficult subject, even if you work in this field regularly. So if you find it's affecting you, please do look after yourselves, check out, and come back and watch the webinar when it feels safer for you. Okay, so do look after yourselves. There are two things that I'd like you to just be aware of. We've got the chat function, which is for saying hello and being connected with people and commenting on what we're saying. And there's also the Q&A function. So if you want us to come to your questions in the Q&A bit, please do use that for then. Okay, great. So I'm just sorting this out, and I'm going to welcome to the screen Sarah Skelton, Head of Programme Development. Hi, Sarah. Please do get us started.
Hi Penny, thanks for having us here today. So I think we're just waiting for my first slide to come up. and Penny's going to bring that up for me, so that's fantastic. Just to tell you a little bit about Papyrus, first of all, if you don't know who we are, we're the UK charity that's dedicated to the prevention of young suicide, and we work with young people who are under the age of 35 and are experiencing those thoughts of suicide, and people who are worried about them, and we also offer a debriefing service to professionals. So if we just move on to the next slide, please, Penny. Thank you. Fab. So you can see there some of the ways in which that we work with individuals are to support, equip and influence. So in terms of our support services, we run a helpline called Helpline UK, and that's a service that runs 7 days a week, 365 days a year, and it's available to all of those individual categories that I spoke to previously. We also equip our communities, and that's through offering training. We also offer a number of resources, and you can see there on your screen that we have a schools and colleges guide, and that's downloadable. We also have recently launched an information booklet for parents in particular, specifically around self-harm and suicide. The third thing that we do is to influence, and that's to come here and speak to people like yourselves and let them know about the work that we're doing, and also to participate in with government conversations, with research, and it's just to make sure that the voices that we're hearing through our communities are heard within that particular setting. So Penny's just going to bring the next screen onto us now to look at our recent suicide statistics. So if you look there, some of this data will unfortunately be very familiar to you. So you'll see there that in 2019 there were 5,316 deaths through suicide. And that question, why young suicide, might be pertinent to some of you. So if we move on to the next slide, we can just see the statistics that are broken down for the age group that we work with. So the number of young suicides between the ages of 10 and 34, the age group that we work with, were 1,516. In 2018, that number was 1,380. So consistently, there is a growing number of young people who are taking their lives through suicide. And equally, we can see that the total number of suicides, there's roughly about 29% of the total number of suicides are from young people, which is why we need to specifically concentrate from Papyrus's perspective about some of the issues that are happening with our younger generation, and start to tackle that immediately, and to look at that early intervention and prevention so that we don't see this number increasing year on year. Unfortunately, these statistics come from the Office of National Statistics, so we don't have any recent data from ONS, but most recently there has been an NHS study that was published between March and June of this year. That's where the data came from, and within that study it was utilising the National Child Mortality Database, so for children under the age of 18, and unfortunately we've started to see a potential increase in the number of suicides again in this age category just for this particular year. We're unsure about the effects of COVID on that particular period of time, because as I said, we've started to see an increase throughout the years. It's the only age category that has continued to grow. However, it's something to bear in mind during our COVID discussions for today. So Penny, I'm just going to talk to the next slide, and within that I just wanted to share some of the themes that were coming up through our helplines, through our communities and our interactions with young people. We call these contributory factors, and some of these may be familiar to you in your services. I know that when I participated in some of the NSPA conversations, some of these themes were relevant, but I thought it would be helpful for us just to have a quick talk through what that means from Papyrus's perspective. So through our communities, we are starting to hear that there are a number of issues for young people around isolation, as we've discussed previously, but more specifically isolation in terms of their identity. So that could be that they are away from their particular communities. So whether you identify as LGBTQIA+, you're away from that particular community because you were isolated, physically away from individuals. We also had some of our BAME communities contacting us as well, well, talking about how they felt that they couldn't access some services in particular, and again that they were away from their own particular communities. For some children and young people, a big focus of that community were their schools and colleges. As Penny spoke to earlier, sometimes school was actually a negative place for those young people, so lockdown proved to be a positive, but for others it kept them away from growing in their own interests, from being able to connect to their peers, and that was a real challenge for them. And I think one of the things that we came through was about family issues. Suddenly people that had space and place to go and explore themselves didn't have that any longer, so there was a real lack of privacy for people, and I'm sure, as all of us can appreciate, when we've been trying to work, when dogs are coming in or children or cats are jumping on our laptops, it's incredibly difficult for people. So those family day pressures, those day-to-day pressures for people have really increased during this particular time during lockdown, and all of these contributory factors have contributed to individuals' thoughts of suicide. Again, I spoke to relationships there, and some of the relationships, as I said, are friendships. It could be the relationship that you have with your teacher or your football coach, or it's not being able to see other members of your family perhaps that you got on with. For some individuals, it's about not being able to see a partner, young parents that haven't been able to access their regular support networks, mental health groups, for example, not running in the same way. So people really losing those relationships that connected to them, and potentially their self-care as well, which we found to be really interesting to look at. And again, unfortunately, sometimes within those relationships, we have seen an escalation in abuse, whether that's physical, sexual, or emotional. We have started to see that. And again, because we're in that concentrated environment, and with particular people being at home, there is no escape for some people within those situations. And with that, we've seen, as I'm sure many of you experienced, an increase people talking to us around their own mental health. So whether that's anxiety, depression, we've particularly seen in young women, people who are experiencing BPD, which is incredibly complex, for people to manage anyway. However, I think when we're looking at mental health services in general, but particularly during lockdown, their ability to access support has been significantly reduced, whether that's because people are unsure of referral pathways, school potentially has been there to refer people, and that hasn't been an option for individuals. Equally, individuals have not been able to approach their peers around that, as we mentioned previously, in terms of that support. Professor Lewis Appleby again spoke to you very recently about the complexities of mental health, particularly when individuals are experiencing thoughts of suicide. It isn't actually noted as a mental health condition or a mental. So for that purpose, it's very difficult sometimes for people to know where to go to access a particular service. So for one of those reasons, again, accessing support has been really challenging. I think a lot of people have assumed that young people have access to technology, so have tried to bring things online. We're all very fortunate that we're here today being able to do this webinar. However, young people, particularly in rural areas, may not have a good Wi-Fi connection, so haven't been able to access support. We equally know that individuals may be experiencing digital poverty, so may not have access to laptops where they need to do an interaction like this. They may not have the appropriate software on a phone, for example. So it's really challenging to get that support. And equally, we found that young people again have experienced a lack of privacy. So even when people have been able to offer support, young people have felt that they've not been able to take on it, whether that's because they didn't want their family to know that they're accessing that support, whether they didn't want their neighbour to know that they were, with somebody coming to have a chat on the front lawn when we could do that in some of our tiered areas, really not wanting to access that support at that time as well. I know in Papyrus we've seen a particular increase in the number of text and emails that we've received in comparison to our calls, and again we attribute that to that lack of privacy potentially that young people have not been able to access. We've also seen young people who have been concerned about other young people as well. So recently, when students have gone back to university, we've taken several calls from some other students who have not known individuals, and that's really challenging as well, because you've gone to a new environment, you don't know people, you don't know where to get that support. But there have been some individuals who've contacted us to say, I'm really worried about this person, I don't really know them, but what we've been able to do is to direct them to that particular layer of support, whether that be to Samaritans, to ourselves, to COOD, to whoever it is that's most appropriate in that moment for that individual. But again, we've got a lot of isolation going on that's contributing to all of this, all of these sorts of suicide. And I think what we're starting to see as well, a shift in some of those trends that I think some of my other peers will speak to in a moment. So finally, if we just move on to the last slide, Penny. Suicide is really complex. It involves multiple people at multiple times and often contributes towards multiple issues. I spoke to you then in regards to the mental health services. 60% of young people, and even more at times, are not known to those mental health services. So what we're trying to do at Papyrus are to empower others like that young person at university to say the S word, to ask people around their thoughts of suicide, to be concerned, and to ensure that we are supporting our communities to become suicide safer. So thank you very much for listening to me today. I'm going to pass you over to my colleague Laura Brown from COOD. Thanks, Laura.
Thanks very much, Sarah, and thank you, Penny, for inviting us today. It's a privilege to be able to present our data for you all. Good morning, everyone. My name's Laura Brown. I'm the Regional Development Manager at COOD, and I'm going to talk through some of our national data insights, paying particular attention to our BAME users as well. Can we take the next slide, please? Thank you. So what is COOD? For those of you who aren't aware of what COOD is yet, we're a digital mental health provider. We have the largest platform providing support to young people across England and Wales, currently accessible to 5.4 million young people, and in around about 80% of the country, including 30 out of 32 of the London boroughs. We're a BACP accredited service, and the service comprises of a number of different elements, one being self-help resources including journaling, goal setting, and also an interactive hub of challenges. We also provide live and static forums so that young people can speak in a peer-to-peer safe environment around what's concerning them, and also post discussion boards so that other young people can engage with them. And we also have a library of articles. Around about 70% of our content is peer created, and we have a team of counsellors available between 12 PM and 10 PM every day, providing therapeutic messaging and also online counselling chats. As well as being the largest digital mental health provider, we also have 19 years of data behind us, and we've worked closely with the NHS during this time. A couple of key elements to be aware of about the service that I think makes COOD quite an important service at the moment for young people, particularly during the pandemic. So it's an anonymised service. Young people can log in without necessarily giving their personal details. I think creating the private space to be able to explore what's going on in the world is really, really important. And we know recently that that invisible cohort needs to be an area of young people that we're reaching. In a recent webinar directed by Louis Appleby, he shared that 60% of young people who ended their lives between 2014 and 2016 were in contact with specialist services. So that's 40% of young people that didn't feel able, for whatever reason, to engage in frontline services. We're also flexible, so the platform's accessible 24 hours a day, 7 days a week. Counselling's available 365 days a year. And we see about 94% of our young people drop in. It's also accessible on the computer, smartphones, and also on tablets. You don't need to download it. And we know that around about 98% of 16 to 24-year-olds now have a smartphone, according to the 2020 ONS data. And last but certainly not least, we pride ourselves on being a safe service. That's particularly important where we're providing digital support. Thank you. Next slide. So I'm going to start by sharing some of our national data insights. Firstly, in 2020, we've had our largest volume of users to date, with 973,000 logins from 127,000 users. Our daily rate has increased pre-lockdown from 2,200 a day to at peak 5,000 logins a day. So we've seen quite a considerable increase. And over the period, that's accounted for 38% increase versus the same period last year. So the presenting issues that you see on the right-hand side of the screen now, they correlate to presenting issues that are captured at the point where a young person engages with a counsellor, either through therapeutic chat or through online counselling sessions. And the sample size that this data is taken from is of over 50,000 users between March and the end of July this year. So that key kind of lockdown period. A couple of observations that I want to draw to your attention. So the prevalence of self-harm and suicidal thoughts, we've certainly seen an increase. It's up 38.5% on the same period last year and accounts for around about 34% of all young people presenting issues that come through to the site. We've also seen a high increase in the number of sleep difficulties, with young people telling us that not only is that lack of routine been really difficult for getting to sleep at night, going to bed later, getting up later, but also having interrupted sleep due to the anxiety that they're experiencing. So we've seen a 262% increase on last year, and sleep difficulties accounts for around about 10% of our total user presenting issues. Also, eating difficulties and body image concerns have increased. They've actually doubled compared to last year, with young people saying that they are finding their personal habits and how they're eating and also how they're feeling about themselves has been really changed by this experience. Loneliness is also a key area of concern and comes up frequently. So we've seen a 55% increase on last year, but I think that what we're finding when we speak to young people is that they're saying the social isolation, being away from friends, only being able to engage via social media or gaming or by telephone, is just not the same as seeing people in person, and they've really missed that peer interaction. Also, the number of young people using our peer-to-peer elements of the site is really increased as well. And last but not least, anxiety issues. So this is all traditionally has always been our highest presenting issue in terms of volumes of young people coming through, but we've still seen a 41% increase on last year. And anxiety and stress accounts for 40% of all our young people that are coming through and sharing their presenting issues with us. Can we go to the next slide, please? Thank you. We also wanted to share with you some of our national BAME user insights. Is this something that is of particular relevance due to the increased risk to that cohort of young people around the pandemic? So I'll start by saying that we have seen an increase in the number of young people that have accessed the site, but the percentage of total young people has remained quite consistent across both last year and this year. Overall, we've seen a 44% increase in acute user logins by BAME users, and they're reporting some similar trends. So sleep difficulties is certainly coming up. We've seen around a 200% increase. Now this data set is actually taken from our June data, so it's not comparable to the slide before, but it just gives you a flavour of what presenting issues we've had coming through in that specific piece of data, and there's around 9,000 young people in this cohort. We've seen a number of sort of key trends. I won't talk through every single presenting issue, but in terms of anxiety and stress, this is also the most prevalent issue for our Black and minority ethnic users, and we've seen an 11.4% increase against last year. Also self-harm, we've seen a 30% increase during this period, and that's compared to an increase of 27% by white peers that have come through to the site. And finally, 159% increase has come through in terms of presenting issues around concerns over schools and colleges, and that has come through consistently across all of our users, but it's particularly high in our Black and minority ethnic users, compared to 144% nationally. If we can go to the next slide, please. So I've just given you a flavour of some of our key insights. So we are producing this data regularly. It was monthly during lockdown, and our next set of data will be due for release at the end of this month. In terms of our response and how we are working with what we're seeing come through from our Kooth users, we're trying to be super responsive, and some of the key ways that we're doing this have been increasing our resource to manage capacity and triage, and so that we can respond. So this included making sure that we have more counsellors available between 6 and 10 p.m, which is when we know a high volume of young people come to the site for support. We also have moved some of our face-to-face services that we have nationally, and they've been moved to that 9 a.m. to 12 p.m. slot in the daytime, so that we can accommodate those users and give them that dedicated support. We've also made some quite significant investments in technology. So I mentioned earlier about loneliness. We've found it really important to encourage young people to feel connected in different ways, and that was part of the main rationale for launching the Kooth Activity Hub, which allows young people to partake in activities they can take offline, come back and discuss with their peers and share ideas and coping strategies, and we found that's been really successful. We've also had to engage with our young people really differently, although we were really well set up because of how we normally work to accommodate the change in working from home. What we have found is that we need to change the way that we reach young people, as we've not been able to go into schools. So the way that we've done that is by setting up a number of really interesting and successful campaigns alongside national influencers who've been able to drive through our our key points around feeling connected and also knowing that you're not alone, particularly around exam results with our Positive Futures campaign, and Pass the Mic, where we handed over to a number of our IMP workers nationally to be able to drive forward the importance of recognising BAME needs. We've also launched all of our accessible marketing pieces around our posters and all of our insights and data to all of our commissioners and wider stakeholders digitally, so that where we aren't able to access, they have that at their fingertips and can send that through their channels to reach young people. And finally, we've been really reactive to local needs. So we've done this in a number of ways. We've driven new pieces of work around pilots where we've launched Kooth to particular groups of young people that we know are at risk. We've worked with Catch-22 and the police and crime commissioners across Leicestershire and Hertfordshire to launch a service for young people at risk of domestic abuse and sexual violence. And we've also worked really closely with a number of amazing commissioners up and down the country to launch services much quicker. Usually we'd look to allow a 2 month time frame minimum, but we've actually launched services such as Birmingham within 2 weeks, and early signs of how they've been taken have been really good. We saw about 3,500 logins just in that first month. Finally, we have been working really hard to be innovative in terms of outcomes, and our research and evaluation team launched the theory of change last year, which we're now using to be able to map the journey of a user and how they're engaging with the services, so that we can start to draw some trends and see how we can create better outcomes for the young people that access the services. Thank you. Next slide. So that's everything in terms of the data today. We do have a lot more available, and we're really happy to share that. I think it's important that we all share the information we have to be able to support one another to help young people longer term. And I'll look forward to questions at the end, but I'm just going to hand over to Susie Phillips, the Associate Director at Winston Swish, who's going to talk to you about some of the insights on bereavement. Thank you.
Thank you so much, Laura, and thank you to Penny and everybody else for having us here today. It's really nice to be part of this forum, and as Laura said, great that we all get the opportunity to share what we know so far with you. So for those of you who don't know, Winston's Wish is a child bereavement charity. We started our life, if you like, in 1992. initially supporting children and young people who had a sibling or a parent or carer who was experiencing a terminal illness, and thinking with them about how best to support them through that process and after that person had died. And since that time, we've expanded in a number of different ways, including supporting children where there's been a death by suicide, and a death through the military, and a death through homicide, and accident and illness related deaths. So really broad spectrum, and largely supporting children where a parent or carer has died, possibly a sibling as well, but those are our main areas of focus. So if we could move on to the next slide, and we can have a think about what child bereavement looks like and what it looked like pre-COVID. So certainly when I joined Winston's Wish, which was about 7 years ago now, I didn't have an idea in my mind that childhood bereavement was quite so common amongst in the population. So we know that every 22 minutes a child loses a parent, making that over 110 children a day being bereaved of a parent, and over 41,000 children newly bereaved each year. We know, as you will know too, that bereavement isn't necessarily something that goes away either. So although that there are lots of people being newly bereaved who will need support for the first time, there are also children who have had a bereavement a few weeks, months, years ago who will also need additional support throughout that time. In terms of suicide particularly, we know that roughly last year, for example, about a third of the children that were referred into our service had experienced a death through suicide. Largely that was a death of a parent or a carer who had taken their own life, and a few sibling bereavements. And it's difficult for us to get exact numbers on how many children are affected each year by a suicide, because although we have information about the number of people that do take their own lives, as Sarah's just been through with us, what we don't know is how many children there are in those families, and we can make assumptions based on the age of the people that have died, but it's difficult for us to gauge exactly how many. So that's what we knew about the landscape before COVID. And as we move to the next slide, we can have a think about what the impact of COVID-19 and the pandemic has had so far. Obviously, everybody has been very mindful of people's mental health throughout this pandemic, particularly when people are having to be isolated and in quite strict lockdown measures for people who were vulnerable, people who were shielding as well. And there has been concern about mental health, well-being, people's levels of resilience, and maybe not being able to access their usual sources of support, and what impact that might have on suicide. And what we know so far is that we haven't noticed a particular change within the number of people that are calling our helpline, or the number of people that have been referred to us for support of a death through suicide, which may yet change over the course of time, but that's what we know so far. Obviously there have been an increase in death rates in general in COVID-19. Those people that wouldn't have usually died from from anything else other than coronavirus have experienced the death. Those people who have had an illness that might have been impacted by COVID-19, whether that's changing a treatment plan or whether that's making them particularly vulnerable to catching the virus, have also been impacted. And that naturally means that there will be more and more children to support following a bereavement. We know that children have also experienced many other losses, and we sometimes call them secondary losses. So that might be the fact that they weren't able to go to school for a number of months, that they couldn't link in with their friends easily, the other support systems that they might have had, clubs, wider community that they would linked in with, haven't been as easily accessible. And people often say to us, when there's been a death in the family, what they really appreciate is that contact with other people. It can be a very isolating experience to experience a death, and a death through suicide can sometimes feel even more isolating because it can be harder to talk about. And actually having people to see every day on the school run, or having somebody pop round to your house and be able to give you a hug, or help out a bit with the cooking and the cleaning and the practical side of things that aren't that easy to do when you're grieving, is really, really important. And know that those are the things that were much harder to do, and in some cases not possible, during the lockdown, and during the restrictions that are in place now, is making that harder again still, and a real worry about what that's going to be like for families and what that's going to be like for children. We know for many families, the being able to say goodbye to somebody has been interrupted and changed through the pandemic. So that might be that if somebody has been ill in hospital or a hospice, then people haven't been able to visit them in the way that they usually would, and that if somebody has taken their own life, and the family haven't been able to hold the funeral that they might have chosen to hold for that family, and that might for that person, because that might be because they weren't able to have as many people as they would have chosen to, or they weren't able to celebrate that person's life or mark that person's death in the way that they would want to, because of the restrictions on what we were able to do at that time, and that continues at the moment, and that's really impacted some people in terms of their sense of not having done enough for the person that's died, not having had that sense of, to a certain degree, a sense of closure at that part of their grieving, and people have been really, really creative in how they've been able to adapt their ways of saying goodbye and what they've been able to do virtually, but for some people that's been incredibly hard. And I mentioned that sense of isolation previously, but isolation is particularly important when you're thinking about suicide. It's hard for people to understand, it's hard for children to understand. It's often a word that they don't really know, they haven't come across before, and there's the big question of why did it happen, and it's not something that is necessarily easy to talk about with peers or easy to talk about with adults, because as much as we've moved forward, there can still be a bit of a stigma around those conversations, and a bit of a difficulty for children in being able to start those conversations. So if we could move on to the next slide. If we consider then the impact of bereavement on a child, and this is any kind of bereavement, these type of reactions would be all the natural and normal responses that we would expect following a death. But if it is a death through suicide, there will be many different reactions, and I always have in mind a family I worked with years ago where there were three teenage boys. I think actually one was 11, one was 14, one was 16, and their dad died very, very unexpectedly. He took his own life, and parents were separated at the time, although the boys still had plenty of contact with dad, and they all responded so differently. The eldest was very withdrawn, quite matter of fact about it. He would talk about it if he was invited to, but he was also very withdrawn. He was just didn't really want to go there, didn't react particularly when he heard the news. He didn't cry, he wasn't very emotive, and obviously very sad, but he wasn't very expressive with his emotions, and that was just his way of grieving. The youngest again was very, very, very sad initially. Lots and lots of questions, particularly for mum, about what had happened, why it happened, and that was really difficult for her to be able to explore with him. The middle son, the 14-year-old, was incredibly angry, and that was he was angry at what dad had done. He was angry that he hadn't been able to stop it, and angry at everybody else in his life that they hadn't been able to do something either. And it took him quite a long time to be able to know how to express his anger and talk about that a little bit more. And so 3 very different ways of responding, and there's no right or wrong way, absolutely. What we often notice following a death through suicide is that there can be elements of guilt, self-reproach and shame about what that means about us as a family, what that means about that person. If we had known, could we have stopped it? What if we hadn't gone out that day? What if we'd come home sooner? Lots of those types of questions. And anxiety is a big feature as well, which is why that's highlighted. And that's been something that we've noticed throughout lockdown, is that though the impact of bereavement has heightened people's anxiety, and that might be in particular related to COVID, but it might also be in relation to, is that going to happen to me? And what might that lead to next? If we could move on to the next slide. What we often say, and the best advice we can give, is don't be afraid to talk about it. Adults often worry about talking about any death, but particularly a death through suicide to children. They worry that they're going to make things worse, they're going to re-traumatize the child, distress them too much. But actually what we know is that the worst has already happened for that child, so nothing you can say can make it worse. And as that says there, it's doubtful that we'll look back and say it was wrong to talk directly and openly to children about difficult things, because actually it's modelling what we do when difficult things happen. Is we talk about it and we try and make sense of it and we share the load, and we don't keep it hidden because it's difficult for children to deal with that. If we can move on to the next slide again. In terms of the support that we offer as an organisation and how we've needed to adapt a little bit through COVID, is what we've done is try and create a network of support around the child from a number of different sources, so that whoever they reach out to, and children will reach out to everyone. It might be a parent while they're driving in the car, it might be a dinner lady while they're at school, it might be the football coach. So the more people that have more information and more comfortable about talking about it, the better. So we've tried to offer website resources for parents and carers, training for teachers, awareness raising in the wider community, free resources. So we've got a book called Beyond the Rough Rock, which is a great source of support for any adult working or supporting a bereaved child, because it talks step by step about how to talk to a child when there's been a death through suicide, and some practical resources to help children too, because we know that children don't communicate just verbally. They will communicate through their behaviour, through their play, through talking with, linking in with their peers as well. And it's also helpful for when there's been a death to help their peers to find a particular language to be able to talk about it, and to understand that it's okay if the child wants to use the word suicide, and that can be really helpful for some children in terms of making sense of things and knowing that this is a different sort of death to another death. If we could have the next slide, please. So we offer, in terms of our services, we've got phone support at the moment for parents and carers. We've got direct support for children and young people. At the moment, that's still online, so it's video chat, it's phone support. We've got our helpline, our support line, live chat, email, training opportunities, ways of getting people engaged there, and our website, social media, publications. We've got a website as well, specifically for children and young people, called Help to Make Sense. So again, lots of different ways for children to access those support networks. And finally, on our last slide, if you do have any questions, if you find yourself working with a bereaved child or young person and you're thinking, not quite sure where to go with this, or if you know somebody who is perhaps struggling to know where to go next, then our free phone helpline is always available. The number there below, which is 9 to 5, Monday to Friday. Thank you so much. And I believe we're going into questions and answers now with Penny.
Hello, hi, thank you so much, Susie, Sarah and Laura. Just such a rich range of information and ideas, so thank you very much. Laura and Sarah, would you like to join us, and we will move into the Q&A section? one of the things that I'm really aware of is that there's been so much change over the last 6 months or so. That lockdown was one very specific period, and then the easing of lockdown, the start of school, and then more restrictions coming in. I wonder if you could just talk to me a bit about how your services have seen differences across those different periods, or yeah, what's changed. Sarah, are you happy to start with that one?
Yeah, thanks, Penny. I think I touched on this a little bit during my presentation. The issues I presented were primarily within the lockdown period, but some of those have been sustained and continued. So, for example, pressures on mental health services, knowing how to access support. I think that there's been, I think I would use the word uncertainty, and I think we've spoken about that quite a lot. Uncertain about what's happening in our lessons when we're going back to school, uncertainty about being able to go to just physically which parents can you go and see, which grandparents can you go and see, which friends can I go and play with, why can I interact with people at school but I can't do that outside of it, students going back to university, and then again some learning is online, some isn't, some's face-to-face. So I think holding uncertainty, which when you talk about that in the context of thoughts of suicide, we're very used to doing that. But I think the issues that are coming along with it have changed significantly because it's now present in everybody's day-to-day. The physicality of not knowing which tier we're going to be in next, as it were, is really difficult. And I think it's really difficult for adults and professionals supporting children and young people to be able to offer that sense of support and safety as well. So I think that's probably one of the things that we've noticed, is that even though the issues may have changed, that uncertainty is growing, as it were. It felt somehow for the individuals we're working with safer, because you kind of knew we're in lockdown, there are the boundaries, this is how we're working, and now it seems more up in the air than others, so a lot more anxiety is coming through, I would say, from our perspective.
Laura, how about with you guys at Cooth?
So since the summer and lockdown, we've come out of that period, we have seen a couple of key trends. So our BAME usage has increased in September up to 21%. We're also seeing a change, as you would expect, as young people go back to school. So over the summer, we were seeing some changes to that 6 to 10 p.m. slot. We were also seeing a lot of people using the counselling around about 12 p.m. till 2 p.m. But that's now slotted back into what we would see in a normal school year. And in terms of the prevalence of trends coming through, anxiety and stress is still very much at the forefront as the highest presenting issue. Anxieties around, are we going into lockdown again? The stresses that are going on in families as they're trying to mediate the way through this. And we've also seen family relationships as the second highest presenting issue in that most recent quarter, which I think is quite telling of some of the strains going on in the background.
Thanks, Laura. And what about you, Susie, in the kind of bereavement support?
I mean, I think I would echo a little bit about what Sarah and Laura have already said, but I think what we noticed when lockdown first started in March was how it was really, I guess, impacting on all levels of people's lives and their grief. And certainly our helpline were having very complicated, long conversations with parents, with carers, with school staff to really explore those issues and consider, I guess, there was the element of the lack of support that there might usually be, but also how the restrictions were changing the way that people were able to grieve, and whether that was complicating the process and the way that children were able to understand what was going on. And we've also noticed alongside that was a surge in the use of all our web resources and requests, particularly from schools, with that at the time thinking about going back in June and now going back in September, how can we best support those people who might have already been bereaved, or who might be considering that they could be bereaved because somebody's very seriously ill. Yeah.
Thank you. And there's a question from Rachel in the Q&A, which is, and I know lots of you do work with schools already, so do you have tips or advice on how schools can support both students and families? And you've spoken a bit about the kind of anxiety about the unknown, but what can schools be doing at the moment? Sarah, do you want to start?
Thanks, Penny. I think just being open, having transparency, keeping that human connection is really important. Sharing that it's okay not to know what's going on. And I think when you're modelling that as an adult, that's so powerful for a young person. And keeping yourself open to that, creating space to say, hey, just come and have a chat with me. All of that, just understand, noticing. I think a lot of people underestimate noticing. So there's, you know, Susie spoke to it before, those small behaviour changes that you will notice as an adult, a constant adult in that individual's life, will understand and know. So don't be afraid to go and ask as well. Don't always expect for a young person to come to you. Try and create some spaces, whether that's saying I'm available 5 minutes after this time, or grabbing somebody and saying, this is your space now, I've got this time for you, it's okay. And as I say, I think it's really important just on a day-to-day creating those conversations and that narrative about well-being. And if, as I say, if you can model that, that's fantastic. I know that some schools are doing things like temperature charts, mood charts as soon as you come into school, creating regular check-ins for individuals. And then if you're talking about specific suicide, safer suicide, well, excuse me, I'm going wrong, specific suicide prevention strategies within a school, what I would say is download our guide. I know that there's so much information in there, and that will give you some information around policy, procedures, and again, some of the advice around language around suicide as well. I think being able to say suicide is really important. Susie spoke a lot to the stigma around it as well. So not assuming that you understand what's going on, and being able to say, you know, are you experiencing thoughts of suicide? Do you know what that means? Is really crucial as well, and empowering people to be able to say that. I would sort of, that was just first things off the top of my head.
Great, thank you. Susie, do you have anything briefly to add?
I think, as Sarah said, I think forming connections with the family is really important in whatever way that you're able to, given any current restrictions in place, and also just not underestimating the power of being there to listen, not feeling that you have to have all the answers, because there are often lots of unknowns when somebody has died through suicide, and you might feel that if a child throws a question at you and you don't know how to answer it, then that's going to be difficult. But it's okay to say I don't know, but I'll find out. And just being there and willing to have that conversation is one of the most important things.
Thank you. Finally, and I'm just taking chair's privilege really, but Laura, you spoke about the specific challenges and needs of BAME young people, and I was wondering if you all could just talk a little bit about, particularly, and actually one of the questioners asked about this with the death of George Floyd and the Black Lives Matter movement, and how that came at the same time, how you've been reaching out and supporting Black and Asian and minority ethnic people differently, young people differently. Laura, are you happy to start with that one?
Yeah, of course. So this was really important to us and has been for a long time, but I think what the summer really gave us the opportunity to do was think differently about how we engage with young people and really understand what they're facing. And support them further. So a couple of things that we did, we launched a campaign called Pass the Mic, and we had a number of our Black and minority ethnic integration and participation workers take the lead on our comms strategy to really engage on topics that are important, including doing webcasts and also sending out some resources to different community groups. We've also, as well as releasing the data to try and raise that awareness around actually what are we seeing, what's coming through, what are young people telling us. We're also engaging with some community groups where there's a higher percentage of BAME young people users, and what we're doing in those areas is looking at content, how do we increase representation, how do we make sure that their voices are heard, because they're incredibly important to us. So we've also flowed a lot of new content onto the website, which we're seeing some really good engagement rates with too. So those are just a couple of the things that we've been doing. But I think really what's lovely to see is that sheer dedication that we're getting across from our commissioners and also our wider network around this. We are going to work to get this right, to really make sure it's fair representation, and that's a really positive step this year that needs to happen.
Thanks, Laura. Susie, how about within bereavement support?
I think we're just working really hard at the moment to try and I guess broaden what we're able to offer and offer it in as many different ways. What we want is lots and lots of different routes in for anybody, regardless of where they are, to be able to use the service if we want to. So I guess that one of the good things that has come out of this pandemic is the number of different platforms that we've now got to be able to work with children and young people, and that it feels that across the UK that people are able to do that, and also working hard to partner with organisations that are already there in those communities and already have those relationships built up, so that they know us, we know them, and we're able to link up with them and think about the best way forward.
Thank you. We're just running out of time, but Sarah, do you have anything briefly to ask about what Papyrus has been doing?
No, just very similar. So again, I think community engagement's been a real key area for us at Papyrus, ensuring that we are meeting need, doing some consultation around that, but also making sure that we're linking in with our volunteers as well. So we have a really great volunteer base, so utilising their expertise and listening to them, again, to help shape our services. So I think that for us has kind of been the focus at Papyrus.
Great, thank you all very much. We do have some more questions, and so what we'll try to do is share these with the speakers afterwards and get some answers out to you when we put the webinar live. But we are over time, so I'm going to say thank you so much to Sarah, to Laura and to Susie, to everyone who's asked a fascinating question and contributed in the chat. Please do look after yourselves, and we will be in touch when we've got the webinar live. Thank you, bye.